This episode is brought to you by Cora tampons. Made from 100% certified organic cotton, every Cora product is made with pure and ethically sourced ingredients. No pesticides, no fragrances, no bleach, no BPA, no synthetic materials. If you're still using conventional tampons, we need to talk. You don't even know what you're putting inside of your vagina. Head over to fertilityfriday.com/Cora today, and you'll receive your first month supply free of charge. This is the Fertility Friday podcast, episode number 144. Welcome to the 144th episode of the Fertility Friday podcast. Thank you for joining me today. I'm Lisa from fertilityfriday.com, and this is your source for information about the fertility awareness method and all things fertility. I'm so happy to be here with you today. I have a really exciting guest. I actually am interviewing a naturopathic doctor, but it's not just any naturopathic doctor. It's actually my own naturopathic doctor. So I'm interviewing my own doctor. But I really wanted to have her on the show, and I've had a lot of requests from you, the listeners, for an episode really delving into seed cycling. And what is it for? And, why do practitioners suggest it? And what can it do in the menstrual cycle? So that's something that we're talking about today. So I was really excited to ask her to be on the show and have her here. At the time of this recording, I actually just recently hosted a webinar with a friend of mine. And so it's kind of at top of mind. So last night I was talking to a group of women and really delving into just the basics. What is fertility awareness? What is body literacy? How can fertility awareness help you optimize your chances of conceiving, and how can you use it as a birth control method? And one of the topics that came up just time and time again was, what about ovulation predictor kits? How do you use them? And are they helpful? And so it was a really great opportunity to share my perspective on them. And that's a topic for a whole show. But just to give you a little sense of what we were talking about, with ovulation predictor kits, they often enforce the idea that women ovulate on day 14. And so even kind of the testing protocol that many of the women that I've spoken to are given by their practitioners, start testing on day 8 with the assumption that you're really going to ovulate by day 14. And, one of the questions that one of the women asked in the group was, what if it doesn't turn positive? And, my answer was, well, it means you haven't ovulated. So all of the charts that I've looked at for the women that I've worked with, it's really interesting to see that even in this day and age, we still cling to the belief that ovulation happens on day 14, menstrual cycles are 28 days, when what I see is a lot of variation, and it varies from woman to woman, and it also varies from cycle to cycle. So if you have found that you are struggling with trying to figure out timing, trying to even understand what the heck is going on with those ovulation predictor kits, or if you've recently started charting your cycles and you're just wanting some clarity around when is my fertile window, when is ovulation, how do I confirm it, I would love to support you in that, because it's what I do. And I love having the opportunity to support women in that, because for me, it's what made the biggest difference in my own life, just having that really clear understanding of the menstrual cycle. So I would invite you to head over to my Work With Me page. So you'll find that at fertilityfriday.com/workwithme. And you can actually book your free 15-minute consultation with me if you have questions about the programs that I offer or anything else. So that's fertilityfriday.com/workwithme. And before we jump into today's episode, I just want to take a moment and thank our sponsor. Now, if you've been listening to the podcast for a while, you already know what an impact Cora has made, not only globally through their program, where every time you buy tampons, you're actually supporting a girl who doesn't have access to tampons in India or Kenya. But in addition to that, they're really taking care of us here in North America, making sure that we're using products that are safe, that are not full of toxins and synthetic chemicals, and can actually help us to improve our health situation. But one of the things that you might not know about Cora is how deeply that feminist message has been integrated into the company. And so one of the things I really appreciate about Cora is that they go to great lengths to employ women who are essentially under-earners. So one interesting piece of information, whether you live in the US or abroad, is that 25 million women in the US live below the poverty line, and they do not have consistent access to period products. We often think in the developed world, this is something that's been solved already. And 93% of the women that Cora helps to employ in the US have experienced domestic violence or sexual assault. And so what's really interesting is that stand that Cora's taken to really support women with this company. So whether it's in the products themselves to support us in leading as clean lives as possible, reducing our exposure to toxins, whether it's supporting girls in Kenya and India through every purchase of Cora products, having that matched and providing pads for girls that otherwise wouldn't have access. But in addition to that, they go to great lengths to actually employ women in the US and really help to bring these women up and above the poverty line. So make sure to head over to fertilityfriday.com/Cora. If you haven't set up your free trial yet, it's a great opportunity to do so. You actually get your first month's supply of tampons free of charge. So again, that's fertilityfriday.com/Cora. Now let's jump into today's episode. And today I'm very excited to welcome my guest, Dr. Nicole Sandilands, on the show. Nicole is a naturopathic doctor who practices in Durham region in the greater Toronto area for all the listeners internationally. So she's really close to home, literally. And she's also my naturopath, which is super fun. The perks of the show, being able to contact you in a totally different context, which is really fun. Yeah. She received her medical training from the Canadian College of Naturopathic Medicine after completing a 4-year honors Bachelor of Kinesiology from McMaster University. And Nicole welcomes treating a variety of health conditions, but she does have a special interest in treating women's health and hormonal issues. And she went through her own challenges to begin her family. She's now passionate about helping others with their fertility concerns. And in her work, she combines natural medicines with conventional science to create a truly integrative health experience. And so I will let you take it away. I'm sure the introduction barely does you justice, but in today's show, Nicole and I are going to be talking about a lot of interesting topics. One of the topics I've had a lot of questions from the listeners about is seed cycling. And we're also going to be talking about natural ways to improve egg quality, supporting sperm health, and generally just ways to improve hormonal health and fertility. So welcome to the show, Nicole.
Thank you. Thanks so much for having me.
Well, thank you for being here. We did go through your background and everything, but I would love to hear a little bit more just about, there's so many different options when you're a student trying to decide what you're going to go into. So what was it that drew you into naturopathic medicine in the first place?
Yeah, so I always had an interest in helping others and in health. And so I pursued an undergrad in kinesiology, really thinking that I wanted to go into physiotherapy. I really was into sports at the time and thought that was going to be where my career took me. But as I started volunteering in different physiotherapy clinics, I enjoyed it, but I realized it wasn't my passion. And so I started job shadowing and asking a lot of questions and trying to learn what else is out there. I actually ended up taking a year off between my undergrad and grad school to really to take that on pretty seriously. And in that time, I actually worked as a personal trainer. And I remember thinking, wow, if exercise can do this much for people in terms of getting them to feel better and move their health in the right direction, there's got to be more natural things that can do this. And so that's what sort of led me to investigating different health professions. And that's sort of when I stumbled across naturopathic medicine. Then I applied and essentially didn't really look back.
Well, and I'm not sure how much you want to talk about this, but I noticed as I introduced you in the bio that you sent over, you mentioned that you did go through some of your own challenges in starting your own family. I would love to hear about just what that was like and how it impacted your practice.
Absolutely. So that's really, I think that's changed the shift of my practice. I never really thought that I would be somebody that would have troubles conceiving. But after about a year, we started to, think, oh, this isn't really happening yet. What else is possibly going on? Everything from a hormonal standpoint in terms of blood works and labs and everything was perfect. We went actually and saw some conventional docs and they said, everything's perfectly fine. We don't really know what's wrong, unexplained infertility. And, a lot of people kind of saying it's stress and you run your own practice and you're taking on too much. And I really didn't feel stressed though at the time. So I had a really hard time sort of accepting that as a reason. And so, the one clinic we were at was suggesting all sorts of treatments and I couldn't pursue it until I knew why. I really had a hard time with the undiagnosed aspect. And so I actually went to a secondary clinic and ended up having laparoscopic surgery and got diagnosed with endometriosis. And I'm one of the anomalies who have literally zero symptoms, no painful periods. I've never taken an Advil in my life for a period. So, when you read the textbook reasons for why you might have that, or the symptoms, I really didn't fit it. So I guess my passion when it comes to fertility is to really understand the why. And once we can understand the why, we can have, we can treat more effectively. And so that's, I think, what's really sort of geared that. I see a lot of patients in my practice who have that, undiagnosed infertility. And this is when we try and do a lot of workups to try to figure out, well, what does that mean? Why is it, I always think that undiagnosed infertility is just, we haven't looked hard enough. And so trying to really understand that sort of root cause, I think, is essential. I think both for patients to really have a thorough understanding, but also clinically for us to be able to implement the best treatments.
Well, thank you for sharing your experience. I can't imagine how frustrating that would be. I've interviewed a number of people on the show, as you know, and of course, when you're talking, it kind of makes me think of a few different things that some of my past guests have said. So I've had several guests on the show that have kind of argued that there's no such thing as unexplained infertility. Kind of like it's like this garbage diagnosis when we just don't know what it is. But ultimately,
absolutely,
what you're saying is really important because it's really kind of a starting off point. We need to figure out why. And also, when in my interview with Mary Wong, one of the questions that I asked her, which I also want to ask you, she experienced infertility, and here she is, a traditional Chinese medicine doctor. So, how did that feel for you? You're a naturopath, right? Like to actually have to go through this experience yourself, that must have been really hard in a number of different ways.
It was probably one of the harder 18 months of my life, but at the same point, I think I've become a much better clinician because of it. I went through the conventional system to get worked up, to get diagnosed, to figure all that out. And as a result of it, I'm incredibly familiar with the process that many of my patients are going through if they come to see me while they're doing conventional treatments. I think it's just made me a better clinician. And I think it's forced me to, be a little, I was always empathetic to my patients, but I think on a whole deeper level now when patients are going through it. So I think it was challenging. It was hard. I think the hardest part was to accept the lack of diagnosis. Once I got the diagnosis, like, okay, I can work with this. We know what to do here now. But when there was nothing, that was very, like a hard place to be.
Well, and I would, I just want to ask you to go a little bit deeper into the whole endometriosis diagnosis. So I've spoken about endometriosis a bit on the podcast. What prompted you to actually have the laparoscopy done? Because I know with endometriosis, that's basically how it needs to be diagnosed.
Yeah. And that's just it. That's the only way to diagnose it. Many times people can have symptoms, so they can have very painful periods, heavy bleeding during their periods. And so it would prompt you to suspect endometriosis. But in someone like myself who didn't have any of those symptoms, you would think as a naturopath, having laparoscopic surgery is a little bit invasive. But when I felt like I'd had probably every test under the sun done, and it was kind of the last one to do, I just needed to know. And so for me, my need to know was so strong that I just, at that point, I said, yeah, absolutely, let's do it. I want to know. So that's the frustrating part, I think, with endometriosis is that unless you have those symptoms, which many people do, but they do suspect that about 30% of unexplained infertility is a result of endometriosis. And so, there's a high percentage of women who were much like me, having a hard time conceiving and not knowing why, being told that it's unexplained, and many resorting to in vitro fertilization, which I don't think is a bad option if that's the route that somebody wants to go. But it doesn't, when you do that, you bypass the diagnosis because it's going to correct the problem, right? I think for me as a clinician, the drive for questions and the need to know was just so profound that I needed to know that. I needed to know what was going on.
It makes perfect sense. Because unless you know, how do you fix?
Absolutely.
So then, how did the diagnosis change your treatment and how you went about everything?
Yeah, so I got pretty lucky. So for me, it was I was diagnosed, but also they can treat you when they do the laparoscopic surgery, so they can remove a lot of the adhesions. So for me, as soon as that happened, I was able to to conceive naturally. But what that has meant for me, and very quickly thereafter, like within the first cycle. So it was like as soon as those adhesions were removed, I was quite fortunate. But what that has meant for me is, knowing this information and knowing that if I want to have a subsequent baby, is that with every period that I have, endometriosis has the potential to come back. And so doing things to be incredibly mindful of estrogen levels in the body, and to try to make sure that I'm detoxifying estrogens appropriately, that I'm not, that my progesterone levels are where they need to be, so that ideally I don't have to go through this again. And ideally it doesn't build up over time again, and I won't have these issues going forward.
Mm-hmm. Yeah, I did a really interesting interview with a gentleman named Dr. Kyle Biter, and he's a NAPRO technology surgeon. So he did his whole thing, and then he chose to go into the NAPRO fellowship.
Love it. Yeah.
And it was such an interesting conversation for me, obviously, because I will never be looking inside a woman's endometrial cavity. So because I'm not a surgeon.
Either by, right?
Right. And so I was able to ask him, because I just am full of the questions. So I was asking him to describe what it looks like, inside.
Oh, interesting. Yeah.
And he actually provided me with he has a presentation that he does. So I put a link to that on the show notes. And so you can actually look at pictures of what endometriosis literally looks like inside the body. And it's really interesting. It didn't look like I thought it would. It can be blistery. It can be discolored. Like it kind of just looks like sick tissue, right? Like it's like black and, And, when he described it, just exactly what you're saying, which is that you assume that it means extreme pain, but that depends on where it is.
Yeah.
Yeah. I really appreciate you sharing your experience. I'm sure that it just helps so many women, because ultimately through the work I'm doing, and I'm sure through the work you're doing in your personal experience, part of it is the treatment and all of the information that we gather and all the different ways you can support your patients. But part of it is being able to ask the right questions. And if you don't know what questions to ask, you can't figure anything out.
Absolutely. Absolutely. Yeah. Yeah, definitely.
Oh, yeah. So profound. Well, so I guess we could shift gears a little bit. We might touch back depending on where the conversation leads us today. But, the topic of the day is around fertility anyways. But as I was mentioning to you when I invited you on the show, I get so many women asking me about seed cycling. So, we're not going to spend like forever talking about it, because I don't even know if we could spend that long talking about it. But maybe you could introduce the concept of seed cycling to the audience. What is it? What does it do? And why would it ever be something that you would suggest?
Yeah, so seed cycling is like a really gentle, natural way to help balance our body's hormones. And so what we do is we actually introduce different seeds at different points in the menstrual cycle to help create a natural rhythm with our hormones. And so it takes a while to kick in. So this is not a quick fix treatment. This is something that, I usually say takes 3 to 4 months to try to see some change. But basically we're using 2 different seeds in the first half of the menstrual cycle. So from day 1, meaning day 1 of your period, to day 14, we use flax seeds and pumpkin seeds. And then from day 15 to 28, day 28 or the onset of your period, we use sunflower and sesame seeds. And so essentially what the first part of the cycle, the flax and pumpkin, is that they're quite estrogenic in nature. We know that flax is a phytoestrogen, right? So it helps with that appropriate detoxification of estrogen, helps to promote the appropriate type of estrogen in the first half of the cycle. And then the second half of the cycle is more progesterogenic in nature. So these seeds contain things like zinc and selenium and linoleic acid, which are all great for helping to support those progesterone levels. And so we're trying to balance out the natural rhythm that should be occurring with each typical menstrual cycle. I use this treatment a lot in practice when women have irregular cycles. I tend to use this a lot for women who have recently come off the birth control pill and their cycle hasn't come back. I really like to use it during that phase. And I find that if we give it a couple of months, the fats that are in these are also great for helping us to build hormones. And so doing it for a couple of months often helps to bring on a normal rhythm to the menstrual cycle, helps to bring it back. But it's a pretty easy thing. I mean, you just simply have to, do a tablespoon of each. You have to grind them. So I usually suggest grinding like a week's worth of flax and a week's worth of pumpkin and leaving them in your fridge, and using a tablespoon of each for those first 14 days. And then the same thing for the sunflower and sesame. Again, they need to be ground, and using a tablespoon of each of those for the second half of the cycle.
Well, yeah, I mean, it's pretty straightforward and it's food.
And that's what I love about it, is that it's easy, right? It's easy. It's something we can implement. It's gentle. It's not our strongest therapy available, but it's food. It's easy. It takes time. So for women who are okay with that time frame, it's great. There's also the situation, I guess I should touch on, when women aren't having, like when their cycles are irregular. I've talked about sort of a regular menstrual cycle. But if somebody doesn't have a cycle, they've come off the birth control pill, or for whatever reason, they just don't have a cycle for many months, then we actually use the moon calendar. And so the what would be the follicular phase, so day 1 to 14, we start when there's a new moon. So if we look at it, pull up a moon calendar, day one would be new moon, and then day 15 would be full moon. And so we would cycle it that way, and that we would just keep alternating based on the lunar calendar, and to try to mimic that natural, 28 to 30 day rhythm in the body.
I love that. That's really cool that you use the moon. Did you want to talk a little bit?
Sound like a
naturopath, but well, did you want to talk a little bit about why you do it that way?
Yeah, so there's a lot of talk about, not so much today in modern days, but in the past, how the light that we would get from the different moons would really influence our menstrual cycles. I think in today's day and age, with all the light and technology and that we have in our day-to-day, it has a lesser influence, I think. But that's the philosophy behind it, is to replicate that natural rhythm that used to be how many women's menstrual cycles were regulated.
And for women then in that situation that you described, who aren't getting a cycle at all at this point, so they're not ovulating, this kind of encourages their body to fall into a natural rhythm.
You got it. Absolutely. Yeah.
And in terms of just what you've seen with your clients, have you seen the impact, or can you think of a couple of situations where you actually, you know what I mean? Like it's cool to theory, but then how does it actually play out?
How does it actually work? Yeah. So I think that my favorite time to use this is that, women who are on the birth control pill and they come off of it and they want to conceive that month, and, the period doesn't come back, and they're, they've been on it for 15 years, and they, hope that their period's going to start up, tomorrow, and they're going to start ovulating on their own. And the body doesn't necessarily do that right away for every woman. And so using the seed protocol can be very helpful for helping to get the periods back on track. And so that's probably my favorite time and way to use it. I do use this a lot sometimes with women who have hormonal symptoms like low libido, or and they're in sort of perimenopause, just to help with that shift with the hormones, just try to get them back into that natural rhythm as well. It can be used for PMS and acne. It's not the first thing that I use in practice, but it certainly can be used that way as well, probably in conjunction with some other things.
Well, I wanted to ask you, kind of pick up on something that you said there, because I say that all the time in terms of as women, we're set up to have these really unrealistic expectations of what our cycles are going to be like when we come off of hormonal birth control. I can't tell you how many emails that I get from women who have just found the podcast, and then, they come off of hormonal birth control, but, 2 months go by, 3 months go by, 4 months go by, and no period.
Yeah.
And what's even more disconcerting about that whole situation is that it's fairly well established in the research that there is a delay in the return of fertility, although it is minimized, because they'll say, within a year or two, cycles come back, so it's totally fine. Yeah. But it's not. But
if a woman's in her mid 30s and coming off and wanting to start a family right away, that that's a lot of time that we're waiting for fertility to restore in a time frame when we know that fertility levels are lower as well, right? Like I've seen this in practice. I've had women in their late 30s and they want to start a family, and they've been on the birth control pill for the last 20 years. And I'm like, nobody's talked to you about potentially coming off of this earlier? which is really kind of disconcerting, for these women because they are just following, the advice that they were given. Nobody's told them that it can take time.
Well, and to compound that a bit further, I can't tell you how many women I spoke to who were proactive and they went to their doctors. So maybe shortly after they, their relationship became serious, or shortly after they were married, or whatever the case, and then they say, well, we don't want a baby right now, but we want to have a baby in a year or two. Should I come off of, the pill earlier or whatever? And the answer is always no.
Yeah.
You should expect to get pregnant within a couple months after coming off of it. It won't be a problem.
Yeah, I advise differently. I always advise to my patients. I mean, it's different if I'm dealing with a 25-year-old female who's telling me that, we're thinking soon, but we're really, it doesn't matter how quickly it happens, then my advice might be different. But for most women who, have made the decision that they want to conceive, they want to conceive now, right? That's the reality for many women. And so I usually advise, in a perfect world, give me a year, at the very minimum, give me 6 months of coming off the pill before actually your start date, basically, of when you want to start trying, because we don't know what's going to happen hormonally, and it might take your hormones a couple of months to settle.
Yeah,
we might need to gene, you know?
Yeah, such sound advice. I feel like, maybe you should be asking your naturopath that question.
Yeah. Or we'll just tell you. I just tell patients.
So to kind of veer off a little bit then into your clinical experience with supporting women who have recently come off of hormonal contraceptives, what is that like? What do you typically see? How long does it typically take for your clients, for your patients, for their periods to come back kind of normally after coming off of hormonal contraceptives?
Yeah, every patient is very different and everybody responds very differently to this. I have, a handful that it took a while to come back, but then I've had many where they just come off of it and like clockwork, their period shows up, in the next month, and it returns to every 28 days. I usually tell patients, look back at what your periods were like before you were put on the pill, because that's what your hormonal system was. That was your normal hormones, right? So if you were having irregular periods at that time, if you were put on the pill to quote unquote regulate your periods, we can't expect that when you come off of it for them to continue to be regulated, because now it's your own hormonal system taking over. And so I usually say, let's look back at whenever that time was. What was going on with your periods then? And the advice to sort of come off might be sooner for somebody who says, oh, no, I only had a period every 6 months, which is why they put me on the pill in the first place. I would say, well, then we need to get off of it sooner, because we just don't know what your hormones are going to do. And so some women are lucky and, they had regular periods before going on the birth control pill. They went on the birth control simply for contraception. And when they come off, it returns to normal in terms of their cycle coming back every month. But I always question, what's the quality of the ovulation? What's your lining doing? And it's one thing to get a period and we can assume that you're ovulating, but what does that mean in terms of everything else that's involved with conceiving, right? And so there's other aspects that might come into play that may not be exactly where they need to be, which is why I think a good couple of months of coming off the pill, having some normal periods without the use of birth control pill, and seeing what letting your body kind of settle and seeing what it's going to do is, good sound advice if you're going to be looking for conceiving.
Well, and from your experience, what constitutes kind of like a normal, say, transition phase between coming off of hormonal contraceptives? So I think that's the part that's missing in the information, right? Like we're missing the whole concept of there is going to be a phase where your cycles have to transition to normal. We don't know how long that's going to be. So where's the line between, okay, this is just your body transitioning and like, this is a problem, we need to do something?
I would say probably three to 4 months is sort of normal transitioning. Once we start hitting 6, then I would say, okay, there's something else going on. Mm-hmm. We need to start looking into it. Yeah.
And that's specifically from so you get off the pill or whatever hormone, you get your withdrawal bleed. And then 3 to 4 months, if your period returns within that time, that's probably normal transition. But 6 months or more is when we have to look into it further.
Yeah.
I had a couple of guests on the show who came off of hormonal birth control and did not get a period, it like 2 years later, like still
Wow.
not coming back. So obviously that's not the norm.
Right.
Those women, upon deeper kind of investigation, often they maybe started menstruating later, or they had really sporadic menstruation, or they went on the
Okay.
pill like really, like there's all these factors that kind of mean that they probably shouldn't have been put on it in the first place.
Right. Yeah.
FYI. But have you seen that cases where you just have that amenorrhea post pill? And if so, how would you support somebody in that situation?
I don't think I've seen 2 years in clinical practice because we're usually doing something before that point. But what I would be looking at, even if we're 4 months out and there still hasn't been a period, then that's when I would start. Even at 3 months, I'd probably start treating something, and whether we start doing some seed cycling, which is just a really nice gentle thing that really any woman could do the moment they get off the birth control pill to help facilitate that normal return. I use a lot of the herb chase tree or Vitex in my practice for this particular situation. Vitex works on that hormone control center, the hypothalamus pituitary axis. And so it can be really, really great for reestablishing normal hormonal rhythms without using hormones themselves. So without using an estrogen or progesterone, we can use an herb that helps our body to naturally create that rhythm. And so that's one of my seeds, and chase tree or Vitex are one of my favorite things in that situation.
Well, and would you take us through a little bit more information about Vitex? I feel like Vitex is kind of like the herb that is the number one source of questions for women, whether it's like, should I take it? How long should I take it? I've been on it for a while. Should I come off of it? How long do I have to take it before it works? All that kind of stuff. Maybe you could share a little bit more about Vitex.
Yeah, so Vitex, like I said, it works on the hormone control center there, and it helps to regulate the hormones. And so it can be used for a number of different conditions, but certainly when we're looking at bringing back a menstrual cycle, I'll often get women to take it for a good couple of months. It takes a while to kick in. So we're using it for usually about, it might take a couple of months for the period to come back, but then we're going to stay on it until the periods are showing a really consistent, regular pattern. And so it can be used for decently enough long time. I would say if somebody has to stay on chase tree in order to have a period, then there's something else going on. Usually, if we can stay on it for 6 months to maybe a year, then once we start to pull away from the Vitex, we should still have a normal cycling menstrual cycle if chase tree is essentially done what it's supposed to do. Mm-hmm. But it can be used safely for quite a while.
Well, and then the question that naturally comes up, because it's exactly what you said earlier, Nicole, which was that often women will say things like, oh, I'm going to come off of it and see what happens. But we've been programmed to believe that we're going to get pregnant the moment that our partner looks at us. So ultimately coming off of the pill, often the underlying assumption is that you will conceive right away. So, yeah.
I think part of that is, though, just sort of shifting expectations and recognizing that, 6 months is a pretty normal, depending on our age, 6 months is pretty normal in terms of conceiving. I always tell patients, like, once we hit a year mark, then we need to start investigating further. If we're under the age of 35, if we're over 35, then we usually start looking into it at about 6 months of trying to conceive. But I think we also need to shift our expectations about what is considered normal. Not every cycle is perfect for conceiving, right? There's a lot of things that have to happen. The lining needs to be thicken up, our cortisol, our stress hormone levels need to be low. And the quality of the egg needs to be appropriate. And also our partner, right? And so there's a lot of things that need to line up for it to happen. And so I think it's important to sort of make sure that our expectations are realistic and in line with what is normal and natural.
I think that that's such an important point, because even in the research, I came across a study that was comparing women who were not on any type of hormonal birth control, so probably using barrier methods, and women who were using they had different types of hormonal birth control that they were looking at, and they were testing time to pregnancy. For the women who had not been on any type of hormones, the average time to pregnancy for them in this particular study was 4 months.
Okay.
right? That kind of
Yep.
blows the logic, right? Just take off
Right.
the condom. Why would
Yeah.
why would I get
Right. You would
pregnant?
think it'd happen right away. Right.
Yeah,
And that's what we've been primed to think.
and then the women who were just come off of birth, like the pill, it was
Yeah.
8 months on average,
Right.
so twice as long.
So, yeah. Yeah.
But just to kind of like, I love that you put that into perspective, because we do need to align our expectations coming off of hormonal birth control.
Yeah.
But then that kind of gets into the Vitex, as we were talking about before, which is that if you're taking Vitex and then you get pregnant, do you keep taking it, or do you come off of it? How do you work with clients in those situations?
Yeah, so it really depends on the patient. I have to double check what Vitex. I believe Vitex is considered a category B, meaning that has not had any adverse effects in humans and has shown safety in animal studies. But I have to confirm that. Depending on the patient, if they conceive while they're on Vitex and I don't have any issues with their progesterone, I usually will have them stop the Vitex. If I have women who conceive while on Vitex and I'm concerned about their progesterone levels, in the past, I used to keep them on low doses of Vitex because it has some progesterogenic properties. And we know that progesterone is so important in that first trimester. Now in Ontario, I can prescribe progesterone suppositories. So my preference now is when a woman conceives, I get them off Vitex and I get them straight onto progesterone if I'm concerned about their progesterone levels, because it's just, I think, a bit of a stronger way, and there's just more research backing it in terms of the safety profile in early pregnancy. And so I do that a lot in practice, and I'll often add in some acupuncture early on in the first trimester as well, for those women who I'm concerned about their progesterone levels as well.
That's so helpful, because it gives us a kind of a deeper sense of what Vitex is doing in the body, which is supporting that progesterone production, and also really acknowledges how important adequate progesterone production is to sustain a pregnancy. And so
I think, I mean, it's interesting in the conventional world, you have to usually have 2 miscarriages before you get worked up, and I think that 1 is enough. And so for a lot of my patients who have, especially my fertility patients who have had a hard time conceiving, once they are pregnant, I often, and a lot of fertility clinics will do this as well, is put women on progesterone in that first trimester just to help support the pregnancy. For a lot of women who it takes them a long time to get there, a simple intervention like progesterone can be enough to make sure that pregnancy makes it to the second trimester. And that's such a critical period that I often will support for women, because I think it's, if it takes you a little while to get there, certainly you want to do everything you can to hold on to it.
Well, and a question for you. So I've spoken about progesterone quite a bit on the show, and I did an interview, which I'll link to in the podcast, which was basically all about progesterone with Dr. Nora Pope.
Oh, yeah, great.
Yeah, and it was really, I think for a lot of listeners, it was really eye-opening. So my question then, because I work with clients in the context of, fertility awareness education. So I teach women to chart their cycles. And then as we're charting, as you can imagine, if a woman's menstrual cycle is not within the normal parameters, then I can, it's exactly what we were talking about earlier with questions. So then it leads us to be able to ask certain questions and potentially like, okay, maybe you should get this checked out, or maybe you should get that checked out. So then when it comes to progesterone, I find it really interesting that it seems to kind of be like, from the medical perspective, doctors who do it will just prescribe it, but they're not necessarily monitoring. So my question is, do you think it's like, okay, we just give it in all cases, or do you think it's like, okay, we go and get a workup, do your blood testing, figure out where your levels are at, and then, is it more of just okay, we just do it, or is it more of like, we should test the levels and then continue to test them to make sure they're okay?
I think it really sort of depends on the patient and seeing where the patient is at. I always think testing and monitoring our cycle, or monitoring our dose based on results always is the most prudent way to do things. So, if we can test and keep an eye on it, the progesterone and support appropriately, I think that always makes some sense. But I think in some situations, that's just not necessarily going to be, it's either not a reality because they don't want to pay for the test. In my world, people have to pay for testing, right? So sometimes financially, it can be a barrier. It's not, when I run labs, they're not covered by OHIP. So if that's the case and monitoring becomes a barrier, I would feel more comfortable making sure that they're on some form of progesterone, to know that we are at least supporting them. than not giving them any just because we haven't tested. But I think in a perfect world, just like anything, the more information we have, the better we can tailor the treatment.
I think that's so sound. And, from a different perspective as a clinician, I'm sure that there are certain indicators that you see in your practice that are a pretty clear indicator that your client has a high chance of having low progesterone. So before the test would then confirm your suspicion, but you have enough clinical.
Yeah, so it would confirm our suspicions. It would also help us to tailor the dose. But you're absolutely right. I mean, in the fertility arena, there's a lot of stress, and when we have elevated cortisol or issues with cortisol, we naturally have lower levels of progesterone. And so I think many women who are trying to conceive, struggling to conceive, progesterone can be a huge hormone that gets affected. And so making sure that we are aware of that and that we're supporting it appropriately, I think is incredibly important for these women.
Yeah, I'm so glad that we talked about that. I feel like it's just so helpful for women to hear these perspectives, because one of the things that I keep hearing from the Fertility Friday community, all the listeners, is kind of like, I don't know of any other places where all of this stuff is kind of like in one place, like this type of information readily accessible for women who really need it the most, because the average age of your first baby is rising, and
yeah, absolutely.
In that situation, and it kind of like, even if whether you're 30, whether you're 34, whether you're 36, we're all kind of aware in the background of this time horizon. And so even the thought of taking 6 months to, do a really active kind of diet, lifestyle cleanup, etc., for a lot of women, that is really overwhelming, the thought of delaying their fertility for even just a 6-month period of time.
Yeah, absolutely. And I think that becomes the challenge with having families later, is that we don't necessarily have the time to do that, but that can be so important for our fertility that it's something that we don't necessarily want to overlook. And I know, life situations, some women don't necessarily have the partner that they wanted to, or they decide to do it on their own, or, life just kind of, takes a quick turn, and it becomes all of a sudden about wanting to start a family and wanting to do that, sooner than later because of that age. But I think we can, in a perfect world, live and lead these healthy lifestyles. We don't necessarily have to have a 6 months timeout to start that, right? Mm-hmm. We can make sure that we're leading the most healthy lifestyle possible, hormone friendly, doing all the right things, so that when the time comes, our body's already in that healthy, good place, and we don't have to take such a huge overhaul in our lifestyle.
Yes, I'm with you, Nicole. I think we got to get that kind of lifestyle piece. I think that it's catching up with us. From my perspective as women, it's catching up with us. And part of it is just a lack of knowledge about how certain lifestyle choices are affecting our cycles. And I would throw the pill in that category of a lifestyle choice, because we're told that it's benign and harmless, but we're not told that about that very real transition period coming off of it. So
absolutely.
Yeah. And to switch gears a little bit, I wanted to touch on natural ways to improve egg quality and supporting sperm health. I know I get a lot of questions about that. What is your take on it, and what are some ways that you have supported your clients to improve that?
Yeah, so I think one of the first things is just what we were talking about, is that diet and lifestyle piece, right? So if we want to make sure we have good egg quality, we need to make sure that we're not introducing things in the body that are going to affect that. So, from a diet perspective, I'll just sort of briefly touch on it, but, no processed foods, eating whole foods, whenever possible, eating organic as much as possible, minimizing any refined carbs, eliminating sugar, alcohol, caffeine. I know this sounds like a lot, but really we break it down to making sure that we're eating good quality protein, good healthy fats, lots of fruits and vegetables, beans, legumes, making sure that we're eating good quality food, I think is one of the most important things. And, smoking, alcohol, and caffeine obviously don't have a place in our body when we're trying to make sure that our eggs are going to be of good quality. And then there's some supplements that I'll use a lot of the times. And I guess I should say as well, managing stress. Stress also can be such a huge factor in affecting the quality of eggs as well. And so making sure that our stress levels, which sometimes is easier said than done, but that they're well managed and that we're well supported. And then from a supplement perspective, one of my favorites for this is actually coenzyme Q10. And I'm sure you've talked a lot about this on various podcasts, but it's part of a family of mitochondrial nutrients that helps to protect us from oxidative damage that occurs over time. And a lot of the damage that's happening to eggs is that oxidative damage. So if we can add in some things that help us to protect us from that can be very, very helpful. And so studies have shown that supplementation with coenzyme Q10 helps both egg quality and fertilization rates. And so, as we know, quality of eggs decreases with age. And so this also helps with improving, aging eggs. So I use this a lot in my practice for women who are, in their mid to late 30s who just need that help with that quality. And I'm finding actually even a lot more conventional clinics, conventional fertility clinics are actually starting to recommend this and get their patients on this. But this is such an important nutrient for that.
Well, it makes sense even for conventional fertility clinics who are doing procedures like, IVF or IUI or whatever the case is.
Yeah.
Because if they're harvesting eggs from your ovaries, if there's not enough or if there's not any good quality, I mean, they can only use the quote unquote good ones. So
absolutely. And it can be such a devastating, to have a cycle that doesn't yield a good quality embryos or eggs, because it's such a financial investment too, right? And never mind the emotional aspect of it, right? So if we can do anything for all of my IVF patients, I say give me a bit of time. Let's get your body in optimal health so that you only have to go through this, hopefully only once, right?
Well, and that's such an important point you raised, and it touches on something that we spoke about earlier, which is that whole idea of taking like 6 months to really focus on improving your health. If we weren't doing that all along. I feel, and I would love to hear your experience with this as well, but the feeling that I get from women is because, there's this time horizon in their minds, there's this time limit that, I need to get pregnant now. I came off the pill. I'm not pregnant. It's 2 months from now. If I'm not pregnant by next month, I'm going to go get IVF. Right. And so what you just said essentially was that for your IVF patients, you're still asking for that time so that you can improve egg quality, improve health. So maybe talk about that a little bit more.
Yeah. So, and then I recognize for a lot of these patients, there is the time in the back of their mind, and they wanted to be pregnant, a year ago, it's 2 years ago, that to then ask for a little bit more time can be frustrating. But for the patients that are willing to do it, I think it's such a powerful and important aspect to ensuring that we're yielding good quality eggs and ultimately good quality embryos. And so I think the other aspect to make sure that we're giving a good amount of time is also for the partner to get involved. I think women take on a huge burden here emotionally. I think it's a big part of it as being a female, but men, their sperm turns over every 90 days. And so if we can have 3 months of good, clean living, essentially, sperm are incredibly susceptible to oxidative damage. And so we need to make sure that we have good quality on both ends, right? Not just the female, but the male as well. And so if we can have that 3-month window, 3 to 4 month window or in a perfect world 6, but at a very minimum 3 to 4 months for both partners to really clean things up, we can hopefully have a better chance of better quality eggs and meets better quality sperm. And so that combination should, in theory and hopefully yield better quality embryos.
Yeah, I couldn't agree more. And I think one of the challenge for clinicians, like yourself and everyone in that coming from that functional perspective, is to kind of balance that with your patient's expectations. Because I think ultimately the impression that I get when I speak to women about this is that they somehow feel that this IVF thing is like a sure thing. So if this doesn't work naturally, then the IVF is going to work. Or if I can't get pregnant, the IUI is going to work. And I'm not saying it's not going to work. But what I'm saying is that your body is still your body. The eggs are not coming from the sky. They're coming from, the sperm is not coming out of the sky either. So if you can shift your mindset around that a little bit and recognize that regardless of how, you end up having to bring your baby into the world, taking that time to really focus on improving your health, your fertility, your egg quality, all of that, it's going to affect the outcomes regardless of whether you're able to conceive naturally or you have to do like assisted reproductive technology.
Absolutely.
And 6 months is going to come either way.
Yep.
So at some point, if it's January, it'll be June. So regardless of what you think about it, like 6 months will arrive. So it's like, is it going to arrive with healthier eggs or not?
Absolutely. Absolutely. And so just being able to, and this is, I think when women are going through fertility challenges, there's a lot that can feel out of your control. But this is one area that I always try and empower women to say, you can change this. Like you can change your lifestyle. You can make yourself healthier. Like you can do this. This is within your control. And I think, fertility patients tend to be incredibly well motivated. And so, but it's also, I think, an empowering place to be, to know that you're doing everything that you can be doing to try to create, a healthy family.
Well, and I love the idea of acting like you're pregnant now, as a way to kind of invite that baby into your body.
Yeah, absolutely.
And something that you said too, because you were talking about ways to improve egg quality and optimize, health for fertility. And so no caffeine. I mean, smoking is a fairly obvious one, but no alcohol. So no alcohol, none. Yeah. Maybe expand on that, because I feel like some women are like, but come on, like I can't have a glass of wine on a Friday. It's been a long week.
Yeah. And so it becomes within balance, right? And within reason. And so the thing we need to know is that alcohol creates oxidative damage for the body, right? And that can affect the eggs. And so, a glass of wine on a Friday night after a long week, is that going to be the end of the world? Absolutely not. Would that be okay? No problem. But to have a Saturday night where we're consuming more than that, or on a more regular basis, we are introducing more oxidants into the body. And so we need to make sure that we're not introducing too many of those, because that can affect egg quality. And so we need to just make sure that it's within reason. And so, some of my fertility patients laugh, because I'll say, okay, you're going to go home now and you're going to have a glass of wine. And they're like, really? And I'm like, yeah, you can have a little bit, but you don't want to have too much. And you certainly wouldn't want to do that with a coffee in the same day, while you're eating processed foods, right? It all becomes about really trying to minimize that oxidative damage as much as possible. And so if alcohol plays a big part in somebody's life today, certainly we need to cut it back. And for women who have very little, to have a small amount from time to time throughout this process, I think is reasonable, but it just needs to be held in check. And I think that's a challenge with alcohol for some people, is that, one glass turns into two, and that turns into a couple the next day. And, we just need to make sure that we're being very mindful of the amounts that we're having.
Well, and I want to approach this next question from a different angle, because I'm sure that you've experienced this as well with your patients. And so, and especially personally, because you had your own journey that lasted for, you mentioned 18 months. So you've been trying for a really long time. Women who are trying to conceive, I've worked with clients who, they've given up gluten, they've given up dairy, they've completely shifted everything. They're buying all organic. They're just doing everything possible. Yeah. And then, they get their period, and of course, like I'm having a drink, like, so, but Dr. Sandilands, like, I've given up everything, right? So how do you just talk to that woman?
And that becomes, that's what's the nice thing about the medicine that I practice, is that I practice really individualized medicine, right? So I don't have a protocol for every patient. I'm talking to the person in front of me. And so for that patient, I would say, absolutely, go have a glass of wine, go relax, go unwind. If that's what you need to do it, no problem, right? And so it's all about treating who's in front of you, where if that patient I know has just started these dietary changes, they're 2 weeks into it, and they just got their period and they're devastated and they're trying to have that, it might be a different conversation than the patient that's been at this for a year, 12 months, 14 months. They've been at it a little bit longer. My advice to that patient might be a little different, where it's okay, let's look at the next cycle, have a half glass tonight, and we're going to, stay the course, because you're just getting started. Do you know what I mean? So it's about balancing that out, and treating the person in front of you. And sometimes stress is such a huge factor here. And sometimes I have patients who, cut out the gluten and cut out the dairy and, cut out everything, and caffeine and alcohol, and are eating incredibly clean. Their stress is through the roof. And then this diet is adding additional stress to their day to day. where sometimes it's just not worth it. And we say, we need to do things to keep your stress down. So if this is creating too much stress for you, that might be counterproductive for you. So we've got to look at, what can we do that's going to keep you, as healthy as possible, but also not raising your cortisol levels, your stress hormone at the same time, right? Mm-hmm. So we've got to really match what we're doing with the patient in front of us. And that's why, it's really nice in my practice because I have time to spend with people. My visits are, half an hour, sometimes longer, right? And so we get time to have these conversations. A lot of times with my fertility patients, I'm doing acupuncture at the same time. So I get an opportunity to check in on a very regular basis to just see how they're doing and monitoring those things and making sure that we're implementing the right changes, but not to their detriment emotionally.
Yeah, very balanced perspective, balancing the very real issues with these, foods and different things, but also acknowledging that we're all human beings and we just have to figure out what's best for us in those moments.
Absolutely.
Well, I recognize we're towards the end of our interview today. We talked about a lot of different things. What is one thing that you really would want the woman listening to take away from our conversation today?
Oh, good question. I would say if you're a fertility patient that is still undiagnosed, see about pushing for more tests to try to get a diagnosis if that is an important thing for you. And I would say of an overall health perspective, just do everything you can. Eat clean, live well, keep your stress levels low. It can be a journey, but I think it's for many, many women, there is an ending at some point. We just don't know at what time point and how that might happen in terms of what interventions might be needed. But I would say just do everything that you can, ask for help. Yeah.
I think those are amazing words to end on. Well, Nicole, thank you so much for being here. It was a lot of fun.
Thank you for having me. Oh, yeah, it was a lot of fun. Thank you for having me.
It was great to be able to pick your brain.
Thank you.
And I really appreciate you sharing your knowledge and wisdom with the audience. And so for the listeners that are fortunate enough to live in the GTA Toronto area and would like to work with you, maybe you could share how they can get in touch with you and find out more about how they could work with you.
Yeah, absolutely. So I practice as Durham Natural Health Center, and we're located in Pickering. But the best way to get information would be to go on our website, which is www.dnhc.ca. So for durhamnaturalhealthcenter.ca, and all the info's there.
Okay, perfect. I feel like I'm gaining more local listeners, so it's really neat.
That's great.
I know there's a few listeners in Toronto, or maybe a lot, I don't know. So you never know, you might get a walk-in.
There you go. Yeah, there you go.
But thank you again, Nicole. It's so nice having you.
My pleasure. Thanks for having me.
Thank you for listening. If you enjoyed today's show, please share it with a friend. You'll find the show notes page for today's episode at fertilityfriday.com/144. I hope you enjoyed my interview with Dr. Sandilands today. It was such a treat to be able to chat with her. As I mentioned, Dr. Sandilands is actually my naturopath, and her office is located about 5 minutes from my house. So it was a real treat to be able to chat with her. As you can imagine, it's nice to talk to her about certain things that would literally never come up in our appointment together. And I especially wanted to talk to Nicole about seed cycling because it was something that she had recommended to me when I first started seeing her several years ago to help to support my cycles in actually kind of becoming more robust and healthy and regular. Historically, my cycles were always on the longer side. There were years of my life where my cycles were like 45 days long and 50 days. And, that was a result of a thyroid condition, which has now been, under control and, a lot of different factors regarding my estrogen metabolism and exposure. And so my own personal experience has definitely guided the work that I do on this podcast and the topics that I share with you, because I know how powerful making certain changes and identifying certain underlying conditions can be in, encouraging your cycle to be healthy and robust and normal. And Dr. Sandilands and I spoke about a couple key things today in the show that are really important. One of which is really aligning your expectations around coming off of hormonal birth control. I think it's really important to know that there is a transition period that happens when you come off of hormonal contraceptives. And even if your cycles return right away, so even if your period returns right away, I can tell you that I have never seen a woman's chart coming off of hormonal contraceptives that was healthy right off the bat. So even if your period comes back right away, I mean, that's awesome. That's ideally what you want. But know that your parameters of your cycle are not going to be perfect right away. You're not going to go from hormonal contraceptives to like a perfect healthy chart. And it doesn't mean you can't get pregnant in that first cycle, because you can. You don't need a perfect chart to get pregnant. But I'm all about optimizing your chances of pregnancy, and not just getting pregnant, also having a healthy baby. You know, the rate of miscarriage is somewhere up near 20%, meaning that, 1 out of every 5 pregnancies terminates in miscarriage. And because it's so common, I think we just think that it's normal. But I have to wonder all of the factors that influence your fertility, all of the factors that contribute to optimizing your chances of having a healthy baby, healthy pregnancy, preparing your body nutritionally and all those things. I just have to wonder if we should really pull the brakes on this get pregnant as soon as possible type attitude, especially coming off of hormonal birth control and going straight into pregnancy, when really, from my standpoint, looking at your charts, seeing the charts, knowing what a healthy cycle looks like, and also knowing what a woman's charts typically look like for those first, say, 5 to 8 cycles after coming off of hormonal birth control, we really need to talk about that transition period and really use that period of time as an opportunity to replenish and rebuild the body store of nutrition, and also to really get your cycles back to a healthy and normal place. So I've spoken a lot on the podcast about healthy cycles. And if you're new to the show, I'll definitely encourage you to go back and listen to a few episodes where we talk more about what a healthy cycle looks like. So one of the episodes is actually one of the first ones, which is episode number 14 with Colleen Flowers. She actually takes us through all of the parameters of a healthy menstrual cycle, from your menstrual period and what the bleeding should look like to all of the different aspects of your cycle. And the point of me bringing that up is just to recognize that there's a difference between getting your period back and having healthy and robust natural cycles. And in my perfect world, the optimal time to conceive is after you've had at least 3 really healthy cycles where your parameters fall within the normal range. So, not just that you got your period back, but waiting until your body has cycled for a while so that we can get to the point where your cycles are healthy and normal. So in my perfect world, the best time to conceive would actually be following 3 perfectly healthy cycles. And that's not always what happens. Everyone's time horizon is different. But when you have that concept and idea in the back of your mind, then a 2-year lead time actually makes more sense, because it does take a while for everything to restore normally. After coming off of hormonal birth control, there is a very real transition period until your cycles return to healthy and normal parameters. And so if you enjoyed this episode, if this is the first time that you are listening, if you're a first time listener and this is the first episode that you're listening to, welcome to the show. So happy to have you here. There's tons of episodes at this point, on these different topics. I would also encourage you to listen to episode 134, the episode that I recorded with Mark Sklar. Although in our episode today, we touched on sperm health and sperm quality and how important it is, I feel like it's really important to always kind of orient and ground yourself in that. As women, we take it on. We assume that it's always us. If there's a problem, if there's a challenge with fertility, we assume that it must be me. And it's really important to know that about 50% of the time, it's if you're having fertility challenges, it's coming from your male partner's side. So episode 134 is a good one to kind of orient that and really kind of drive the point home that it's not always you. And also, if you're enjoying this show and you like to connect with your people, women who are also wanting to learn more about fertility awareness, learning to chart their cycles, and just really delving into this topic of, improving your health from a holistic functional standpoint, head over to fertilityfriday.com/community and join our Facebook group. So I host a Facebook group, a private Facebook group for the women in the Fertility Friday community, and we chat in there about past episodes, and lots of great questions and discussions come up in there. So definitely join us in there. And I just want to thank you so much for listening to the show. I really appreciate you for letting me be part of my day and bringing me along whatever you're doing, whether you're on a road trip right now and you're catching up on episodes, or whether you just, you're going for a walk or walking the dog, or, doing chores around the house, or even if you're at work listening to the show. I really appreciate you for being here, for supporting the show. And as always, until next time, be well and happy charting.